left is often due to one of two things: the position that the neck is in, or the inability to breathe with your left diaphragm. So when a neck is positioned to the right, so it's oriented to the right, as in the right BC and then right TMCC pattern. Now, you don't necessarily need to have the right TMCC pattern to have a base of your neck oriented to the right. That could just be a continuation of the right BC pattern that's coming from the ribcage. In that position, the left scalenes that go from C3, so the third cervical vertebrae, and attach on the top two ribs, or the first two ribs on the left side. These are the left scalenes. They are going to try and pull your neck to the left, but they can't do it because you're stuck in a pattern that you can't get out of. But just because you can't get to the left, so your neck can't side bend to the left and kind of orient to the left, doesn't mean that those left scalenes are not going to keep trying to do that. So that's one reason why the left scalenes and the left neck in particular can be sometimes painful, because it's trying to get you to the left, but you can't do it. So it just keeps trying. Now, the other reason is because you can't expand your rib cage backwards on the left. So with the rib cage on the left side, this is the back, right? So this is the back, this is the left, this is the right. I mentioned in a couple videos, we call this the left posterior mediastinum or left posterior rib cage. That needs to expand. If you can't expand that rib cage, you cannot use your left diaphragm properly to work as the main breathing muscle on that left side. So what you're going to have to do is start to use your neck to help pull air in. And you don't want your anterior neck all through here and quite often on the right side. You don't want these neck muscles to be pulling the rib cage up, like the scalenes could be trying to pull the first two ribs up to help get more air in. You don't want that to happen. You want the rib cage to expand via diaphragmatic breathing. But again, in these patterns that we get stuck in, our ability to use the right diaphragm is usually well maintained. The left diaphragm, though, usually drops out completely. And in order to expand that posterior mediastinum, you need left foot pronation, a pelvis or a femur, an upper leg bone that can internally rotate. You need a pelvis on the left side that can get into left AFIR, which is an internally rotated pelvis. That pelvis needs to also extend, needs to move back. Because remember, in the pattern, it is forward. So we need to pull that pelvis back into posterior rotation. And then we need to exhale to get the ribs on the left down so the back side posterior rib cage can expand back and open up. And at that point, if you have all those things, that means you can get to your left side and the neck doesn't have to be used for breathing. And at that point, when you have all those things on the left side, the spine and neck can finally orient to the left to get into true left stance position, and those left scalenes can finally relax because they accomplished their mission. They got your neck to side bend to the left, or the base of the neck to side bend to the left and to move to the left. And that also gives the right side the chance to finally relax. So it all goes back to that left side. You have to establish true left stance. And left stance equals pronation, internal rotation of the femur, internal rotation and posterior movement of the pelvis, ribs on the left side that go back down and in to establish that left ZOA that positions the diaphragm properly. You'll then be able to expand the posterior rib cage. You can breathe using your left diaphragm at that point, and that neck can finally turn off. So, just to reiterate, left neck pain, left side neck pain is usually a grounding issue. You're not grounded on the left side, meaning you don't have proper position. All those things, that checklist that I just said, that's not happening. When that can happen, that left neck will finally be able to calm down. And remember, That might sound confusing, but every PRI exercise, for the most part, is attempting to do all those things, or it's putting you in a position, in a starting position, to accomplish all those things. So that's why in order to fix a neck or to improve or take away neck pain, you don't really touch the neck. You start with grounding. You work from the bottom up. Left foot pronation, internal rotation of the femur, internal rotation and posterior rotation of the left pelvis, left ZOA, posterior ribcage expansion, moving the ribcage back, and at that point, the left neck can finally calm down.